I wanted to just welcome everyone and say thank you for being here, and thank you for being a part of our Carolina community. If I haven't met you yet, I'm Christy Page. I am CEO of UNC Health and Dean of the UNC School of Medicine. I'm so excited to be with you. They call me a triple Tar Heel, but there's actually I did a lot of school at Carolina. So I totally bleed Carolina blue, which, kind of pops out in my dress and on my arm as well. But this weekend in the ACC tournament and all of the excitement, it's always a special time, but it's especially wonderful to be here with you this afternoon on this glorious day right here in Charlotte. You're going to hear some amazing things today, and I hope that you leave inspired and impressed and eager to become even more connected with us at UNC Health and the School of Medicine. So we're going to talk about some of the really innovative and creative work happening across our health system. We do have a presence here in Charlotte with our medical school partnership with Novant, and I want to be sure that we also highlight some of the beauty of the training partnerships that we have here, because our research and the extent that we can extend that and make that easier to access clinical trials, the training programs that we do that have trained more doctors in North Carolina than any other school, and the clinical care that we do that we're able to partner and do in really creative ways as the state's health system, now in 20 hospitals all across the state with 56,000 coworkers. It's really grown, and we're really leaning into that role as the state's health system, and just so grateful that we get to serve North Carolinians the way that we do. We have several alumni, friends, donors, lots of different ways that you all are connected with us here, and hope that you'll also get to know one another. We also have some of our Medical Alumni Council board members today. So if you're on the Medical Alumni Council, will you raise your hand? Or there you are. Thank you. Just tremendous service, and really appreciate that. So I'd like to introduce our moderator today that most of you know, a wonderful friend to me and to our School of Medicine, Dr. John Kirkland. John is a proud Tar Heel, and he's a practicing urologist here in Charlotte. He's also former chair of our UNC Health Foundation Board of Directors, and he's past president of our UNC Medical School Alumni Association as well, and he's also the recipient of our Distinguished Medical Alumni Award in 2023. But most of all, he's certainly passionate about Carolina and our School of Medicine and UNC Health, but just a man of very strong character and someone I'm proud to be able to call a friend. So with that, I get to welcome Dr. John Kirkland.
Oh, thank you. Good afternoon. Thank you, Christy. I really appreciate those words. It's certainly an honor to be here today with you and our distinguished panelists who you'll hear from in just a little bit. Like Dr. Page mentioned, I am John Kirkland. I'm recently finished practicing urology. So I'm now doing other things. But like many of you here, my connection to UNC spans decades. And this is going to sound a little weird, but my connection to UNC is almost umbilical. And I know that is an odd way to put it, but my parents went to Chapel Hill, and so even in the prenatal stage, I was connected. They say that you don't get to pick your parents. Well, I didn't get to pick Chapel Hill. Chapel Hill picked me. My parents both went here, and when my dad was a resident in OBGYN, we were born in the old North Carolina Memorial Hospital, so it's back in the 50s. Spent some time at Glen Lennox, which has probably been knocked down right now, but so my relationship and connection goes way back. As an undergraduate, my brother and sister, all my cousins went to Chapel Hill. I met Chris, my wife, on Franklin Street in our junior year, and we got married during medical school. So later on, two two of our daughters came to Chapel Hill, one in undergrad and another one also attending medical school. So we've had a lot of my major milestones have intersected with this beautiful system, UNC and UNC School of Medicine. But I want you to know it's not really out of an obligation that I'm here. It's really out of the love for the university that I'm here today to be a part of this event. I really care deeply about our healthcare in the state, but also being delivered by folks like this. We're in good hands. Just you'll know we're in good hands. This is the leadership. Some of the leadership with Dr. Page is here today. It's a very unique opportunity to be able to hear in an intimate setting like this, to have this opportunity for all of us to be together. So it is with great pride that I share the stage. I think what we're going to do now is going to let our distinguished panelists introduce themselves. Samantha, why don't you start?
Sure. I'm Samantha Meltzer-Brody, and I'm a psychiatrist and expert in women's mental health and have the privilege to work with Dr. Page and team as the executive dean of the School of Medicine.
Hi, I'm Dr. Kelly Lawrence. Here in Charlotte, I serve with Novant Health as the Senior Physician Executive for Medical Education. And for the UNC School of Medicine, I serve as the Charlotte Campus Director. My practice is in family medicine and also in breastfeeding and lactation medicine.
Hi, I'm Matt Nielsen. I'm a urologist and I'm the chair of urology at UNC Chapel Hill. I wasn't born in North Carolina, but I got here as fast as I could, and I've been here for 18 years. My kids were 1, 4, and 7 when we got here, and now they're freshmen, senior, and proud alum of Carolina. So we also have deep love for this school.
So the way this is going to work, we're going to, one by one, sort of have a little presentation. So Samantha, we're going to start with you again. I know that, in your role as chairman of psychiatry, you have a passion for women's health and as well as behavioral health. But now that you're in this expanded role, I know you touch a lot of different areas, but tell us what excites you about UNC right now, and just like to hear from you.
Sure. So there's many things that excite me about UNC right now. In fact, I could talk for about 3 hours, but no one would like that. I came to Carolina in 2000 and have been in the Department of Psychiatry during that time and was the chair until I had the opportunity to join Dr. Page in my new role. One of the things I'm really excited about is our strength in women's health broadly across the institution. We have deep expertise across the lifespan, so onset of puberty through aging. And for example, Genevieve Neal Perry, who's the chair of the Department of OBGYN, that department is nationally ranked, has one of the top NIH-funded departments of OBGYN in the country, and have deep expertise from GYN oncology to other GYN issues to obstetrical issues, and they really do fantastic work, including global health. Caprice Greenberg is the chair of the Department of Surgery and an expert in breast cancer, a breast surgeon. And that work is really impressive and growing. We have Lisa Carey, who's an international expert in breast cancer with Lineberger Cancer Center. And the chair of radiology, Maureen Cohey, is an expert in uterine embolization and other things that make her an international expert in that area. And then I, of course, am a bit biased about the Department of Psychiatry and our UNC Center for Women's Mood Disorders, which takes care of mental health issues through pregnancy and the menopause and beyond. One of the things we're very proud of is the Birch Scholars, which is a very large NIH-funded award, and that is being run out of Department of OBGYN with Genevieve Neal Perry, who I mentioned, the chair, and Lisa Rahangdale, one of our distinguished faculty members. And this is an award that's near and dear to my heart. I was a Birch Scholar early in my career, and the protected time for research allowed me to compete and get the training to be a successful investigator. And it was at UNC for a long time, and it's now back and better than ever. And under the leadership, they have the new cohort coming in. And this really makes careers for people because it gives the protected time for our investigators to be ready to compete. And so the depth and breadth of what they're studying in women's health and related things is really extraordinary. So we really feel strongly that if you're taking care of women and moms, often that's the entree into healthcare. Often women make decisions for how families get care and connect with care, and it really helps people come in and then often be there to take care of women, children, husbands, family, and whoever over the course of their lives.
Yeah, no, well, that's a nice segue because women take care of men, and we're going to hear about men's health from Matt Nielsen, the chair of urology. But first I want to publicly acknowledge and thank Dr. Nielsen for always accepting my challenging patients. I'm a urologist, and whenever I got in trouble, I would call Matt, and he would graciously said, "Send them on down," and they've received superb care. So anyway, thank you for all the times you helped me out. All right, Matt, why don't you tell us a little bit what's going on with men's health at UNC?
Yeah, well, we're really excited about men's health. There a lot of things in our department have been focused in the prostate cancer space. Prostate cancer is the most common cancer in men. The changes over time in the way the technology and the different treatment approaches have evolved have really had UNC kind of front and center at that. A lot of the research that we've done has led to changes in our national guidelines. A lot of our faculty are on the national guidelines committees and other national leadership roles to help define the standards of care. And that sort of evolution in the 18 years that I've been here of the ways that prostate cancer is managed now has really been transformational, and it's been an exciting thing for us. We're trying to take that care that we have in Chapel Hill and think of new and creative ways to expand it across the state using virtual care, reaching more men in rural communities, and a big focus on underserved communities in particular, and some big opportunities with health disparities there. So lots of exciting things in the sort of narrow space of prostate cancer. It's a big tent. Many men are affected by it. But we're also starting to have some really exciting conversations about men's health more broadly, thinking about mental health, thinking about how men in general don't often go to the doctor as much as they might do, and often have preventable conditions that escalate over time and unfortunately lead to lower life expectancy in men, about 5 years less than women, higher rates of death from many preventable causes, and trying to change the conversation around men's health to acknowledge that bigger scope beyond what we do in urology, and also acknowledge that men's health is family health and affects women and has impacts on communities and the sort of economic impact on the state also. So we've got some great partners that we're starting to have that broader scope with.
That's great. Yeah, I don't think there's anyone here who hadn't been touched by cancer of some form, and so we really appreciate all the work you're doing. And I know there's a a little bit of a manpower shortage, and so that's where our next panelist comes in. Dr. Kelly Lawrence is an educator. She's here in Charlotte. She's in a unique position between Novant and UNC Health, which I think is a wonderful thing. So, we have students in Asheville and Wilmington and Greensboro and Raleigh and Charlotte. We've always had folks in Charlotte. And so Kelly's going to tell us about what's going on in your world.
Perfect. And also, I'm right in between women's health and men's health. And as a family medicine physician, I feel like I'm just in the right spot. So I will say, I think we've been making great strides here in Charlotte over the past few years. As the campus director for the UNC School of Medicine Charlotte campus, we just welcomed our 5th class, our 5th cohort of clinical phase students. So these students do their foundation phase, or kind of that classroom time, in Chapel Hill, and then they come to us to do their clinical training within Novant Health and then in the community as well. So that's been very rich. We look forward over the years ahead of growing to approximately 30 students. Right now we're at 10. I welcomed 10 last week. They are bright-eyed, bushy-tailed, and they started rotations this Monday morning. I've been hearing nothing but great things. Charlotte is a place that people want to be. I don't know, many of us here are in Charlotte, practicing in Charlotte, living in Charlotte. Our medical students are no different. So our campus is quite popular. I can't wait to grow it for more students to come. And one of the reasons is that we know that wherever people study and train, they tend to stay. And so we want more doctors here in Charlotte for our community. Within my other role with Novant Health, which kind of, as you said, John, spans UME and GME, we are working to build more residencies for these medical students to have residencies to land in Charlotte. So at present, Novant Health has a family medicine residency that's been around for about 11 years. We're growing by 2028, I'm saying it now, internal medicine, surgery, OBGYN, psychiatry, and neurology, not urology, neurology. So we're growing those 5 and looking forward to that. Additionally, within the workforce pipeline in our area, we're doing something really cool that I wanted to tell you about for a moment. One of the students that I welcomed just this week is on an accelerated community health track through the UNC School of Medicine. So as we all know, medical school is usually a 4-year endeavor. For some students who know that they want to go out and practice in the community in a primary care or community care framework, there's the possibility of a 3-year medical school track. And so we just welcomed our very first student who's on that track, who once worked as a scribe at the Hope Clinic here in Charlotte. She's trilingual. She wants to do family medicine, and she matched into our campus and will already be matched into our residency when she finishes this 3rd year of training. And I look forward to giving you the to be continued for the next time we talk about how it's going.
Well, thank you, Kelly. North Carolina is growing so fast, and so is Charlotte, and so, we take all the doctors and healthcare providers we can get. So thank you for that. And that's really exciting that Charlotte's going to be partnering with Novant and UNC. So I think we were not going to do the Q&A. We want to leave some time for everyone to be able to come up here and ask your questions privately. But we do want to hear from, where's Margaret Ann Bolmeyer? There, come on up, Margaret Ann. Margaret Ann is the president of the UNC Health Foundation, and she is going to tell us a little bit about what that means.
Thank you, John. And please join me in thanking our panel. Thank you, guys. So we heard some brief presentations, and really what we're envisioning for the rest of the evening is that now you know a little bit about our speakers, you know a little bit about the work they do, and it gives you an opportunity to really learn more. You could ask your questions, you can engage in conversation, you can share your experience, and I know that they're really interested in talking with you. So that's why we do these kind of events, is that we really want to spread the word about the very innovative care, the cutting edge research, and the wonderful education that UNC is providing to the people of North Carolina. The compassion and dedication of this team is really unbelievable. It's really so inspiring for me and for our whole team at the foundation. The foundation supports the UNC Health, the whole health system, and the School of Medicine. And many of you, maybe everyone in this room, is a donor to us. And we thank you for that, because the impact of your gifts, it makes a huge difference here. There's research that would never happen without philanthropy, because we help researchers do that baseline, that first level of research, so that they have the proof they need to go out and get a very large federal grant. So it's really important, because without that first level of research, they don't have all of the evidence they need to justify the larger grants. And speaking of grants and research, we're one of the very top funded schools of medicine in the entire country. Is it number 5? Number 5 in the whole country. And how many medical schools? Of public universities. There are hundreds of public universities in our country with medical schools. So we're at the very top of the work doing this research. And so I want to say thank you to you. Thank you for being here. Thank you for your support. We couldn't do it without you. The foundation, currently we have about $760 million in assets, And what's really important about that is it represents more than 2,000 individual funds. So some of those funds are scholarship funds, some are professorships or other faculty support funds. Some of them are research funds. Some of them support care for people who don't have resources. Some of them support some of the great programs that we do. So if you want to hear more about that, we have a number of members of our team from the foundation here. I'd be happy to answer your questions. I do want to thank them for all of the work to bring this wonderful event to you.